The first thing is always inspection. Try to see what is wrong with the valvular area, okay? Any bruises, any masses, any signs of infection, okay? This is important. Any signs of infection or inflammation. Or if you think that there is something wrong with the distribution of hair, then maybe you will have to do some more imaging or other tests. So the first thing is always inspection. In gynecological and obstetrical examination, we usually do not do percussion. Okay? We have inspection, we have palpation, and we do not have auscultation. Instead, we have ultrasound examination. So first step is inspection. Of course, it's not very easy to understand what you are going to look at the first time, but in time you will learn. After you think that everything's all right with the exterior genitals, then let's start the famous digital vaginal examination. In Turkish, a word that's borrowed from French, toucher. Toucher means touch. Okay? Toucher is a Turkish name. Yes. And this is called a vaginal toucher or digital vaginal examination. Now, there is the pubic bone, okay, on the superior aspect.
Okay.
Okay, there is the pubic bone, but there are no bones on the sides and in the inferior aspect. So, if you insert a single finger inside and then press up, you are going to squeeze the soft tissue between your finger and the bone, and she is going to feel pain. So, never, never, never. After inserting your finger into the vagina, do not try to go upwards. No, never. Try to go downwards. Okay? If you want to, let's assume that you just inserted one finger inside. That's how it's done. Of course, you have to have gloves, not with bare hands. With your gloved hands, you insert one finger in, and you are going to want to insert your second finger, your middle finger, but before doing this, never go upwards with your index finger. Always try to press down so that you are going to make it wider. Okay? And insert your second finger. Okay? Don't forget, never go upwards. You are going to squeeze the soft tissue between your finger or whatever device you use for the examination and the pubic bone. Now, for a gynecological examination, we use a device which we do not use during the obstetrical examination or routinely. Speculum. This is an automated speculum. What does automated mean? This is a simple device with two pieces, and this one connects the two. So when you open it and turn it around, it remains open. Of course, you should not insert this without any lubricants above it, okay? You should always use some kind of water-based gel, inspection gel. We do not have it around. Okay. We have you ever seen ultrasound gels?
Mm-hmm.
Okay. We are using that ultrasound gel for examination. And for doing the examination, first we lubricate it. Okay? And then, before inserting it, we rotate it like 90 degrees like this. Why? because the vagina's shape is like this. The longitudinal axis is longer, so we insert this speculum into the vagina like this, not like this. We start to insert it, and then we turn it slowly and open it inside. We do not open it outside and try to insert it like this. This is going to hurt the patient. So, well, we need it to be open like this for the examination, but we do it inside. So, we start rotating, insertion, turn it to the original position, and then open it and lock it. Right? You will do it, everyone. After doing your examination with this speculum, you can just proceed with your digital examination. And as I said, after inserting the first finger, press down, insert the second one, okay, and try to go forward, and there somewhere you're going to run into the cervix. Cervix, if your patient is not pregnant, I'm going to talk about it in obstetrical examination. If your patient is not pregnant, you are going to run into something that is hard. Your fingers will touch something that is hard. Okay, that's the cervix. With the cervix at the tip of your fingers, try to elevate the cervix. This is going to help elevating the uterus altogether. I don't know if that device is here. No, it's not. Okay. When you insert your hand inside, okay, come here. I'm going to use you as a hand. Now, he is the uterus, okay? When you insert your finger and the second one inside, you are going to run into the cervix. When you touch the cervix, try to elevate it. When you elevate the cervix, you are going to elevate the uterus as well. And, thank you. And when you palpate from the upper side, you are going to feel the fundus. Okay? And if the patient has a substantially large myoma, then you are going to feel it with your hand. Of course, this depends on the patient's body composition. In obese patients, your chances are severely diminished about this. Okay. Now, just make a line between yourselves.